Hello everyone, Rachel here. So I'm so excited to be able to start this live stream of breastfeeding Q&A. So for those of you who don't know, my name is Rachel. I am a lactation nurse. I've worked postpartum for about 8 years. I've also been a lactation nurse for quite some time now. So a lot of my clients were asking me questions about breastfeeding, baby care, and I figured it would be a good idea maybe to share some of these questions, some of these answers, so that it can hopefully help other moms as well. So I thought I would start out with some questions that some people have already sent me. And what's really nice about YouTube is you can always go back and look at look at the video later on as well. So I have a few questions here I thought it would be good to answer. So my first question is, my baby is in the NICU. Can I still breastfeed? So that is a really good question, especially moms that are in the NICU. One really important thing about breast milk is that it can help your baby to recover from illnesses, protect from respiratory diseases, especially if you have a premature baby. What's really awesome is that mom's breast milk is specifically tuned for your baby. So for example, let's say you have a premature baby, mom's breast milk will be able to cover that baby for whatever issues might be affecting that baby, whether it be GI issues, respiratory illnesses. So it also goes hand in hand with the question that some people ask about, like, let's say I'm sick. If I'm sick, I get this all the time. If I'm sick, can I breastfeed? And the answer is, if you are sick, you definitely want to breastfeed, because your antibodies and your protection will be able to go to your baby, which is something that really is important as well. So if you're in the NICU, can you still breastfeed? Yes, and it will have some amazing benefits to the baby as well. Now, how to breastfeed? The most important thing is, if there's a separation between you and the baby, to try to stimulate the breast as soon as possible after separation. So let's say mom has a separation from the baby. Mom is in labor and delivery, and baby has to go to the NICU for whatever reason. What you want to do is start pumping as soon as possible. And when you are pumping, try to do active pumping as well. That's where you're not just kind of sitting there like this, but you're actually actively massaging the breast. You're using all of your senses so that you can better be able to protect your milk supply while the baby is in the NICU. So keep that in mind as well. Another thing is, you want to, if you can, visit the baby and breastfeed. Skin to skin is very good, especially if you can do skin to skin a little bit before you go to visit the baby. That will be most helpful for your baby as well. So for babies in the NICU, you want to breastfeed. It has some great benefits for the baby. And then some things you can do is make sure that you are stimulating the breast as soon as possible after separation. Usually they say at least, about 1 hour, just as if, let's say, baby was with you. Usually they'll say start your first breastfeeding session within 1 hour. It's very similar to NICU moms. You would want to start that first breastfeeding session within 1 hour. So you would want to have that first pumping session also within 1 hour. So that was a very good question. And then you could just keep frequent and effective pumping sessions about every 3 hours or so, 2 to 3 hours or so, for about 15 minutes, an electric pump, and you also can hand express as well. And that goes for number 2, which is hand expression and how to hand express. So the basics of hand expression is, you want to try to stimulate as much as possible as a baby is. So hand expression is a very common question that I get, just because it has so many benefits for breastfeeding moms who know how to hand express. And basically what you're doing is, like, if my breast is here, your nipple's here, your areola is that dark part around, you're going to want to compress, go back where the areola is, and bring your fingers together kind of right behind the nipples. So you're actually going to be coming up underneath your breast in a U shape. Instead of a C shape, you'll actually be more of a U shape. You'll go back and then together. And then if the nipple is pretty much pretty much putting your fingers together behind the nipple, but not exactly squeezing the nipple. So that is what you're doing with hand expression. So hand expression really helps, especially if you have a baby in the NICU, or if you have a baby that's not latching very well, or even if you are very engorged and it's hard for the baby to latch on. Sometimes some hand expression, some reverse pressure softening will help soften the breast enough for the baby to latch on. So that's really exciting too. So that was my first question, was about the baby being in the NICU. My second question is, I am 15 and pregnant. How do I make enough milk for my baby? So that is actually a really great question. And the main basics of breastfeeding is the same, whether you are 15 years old or you are 30 years old. It does not matter how old you are when you are breastfeeding, because the basics are the same. It's all stimulation and production. Your milk supply is related to how much stimulation the breast is getting. So if you're frequently and effectively breastfeeding your baby, even though you're 15 years old, you would still be able to make milk for your baby. And actually, as a postpartum nurse, what I've noticed also is that the younger girls, they tend to actually produce a lot of milk as well. So even if you might be 14, 15, what you want to do is breastfeed, because the breastfeeding will actually probably even come a little bit easier to you. Usually, even if you are older, you can still breastfeed, but one thing that you want to do is you want to have frequent and effective breastfeeding sessions. The more you drain the breast, the more milk is released. And we're having a few people, and I just wanted to say hi to everybody that's joining. I know that it's a funny time in the middle of the day, but feel free to say hello, and if you're expecting, or if you are postpartum, how old your baby is, and I can be able to gear this more specifically to you as well. But that's the beauty of live classes, is that we can always interact with each other and hopefully be able to support each other in this as well, because it's hard to be a mom. So we were going over frequently asked questions. I was going over the baby is in the NICU, how can you breastfeed? I was going over, if you are young, how can I make enough milk for my baby? We mentioned that it doesn't really matter how old you are, as long as you are frequently and effectively breastfeeding your baby. You can also do skin to skin as much as possible. And hi, Jacqueline. And 8 months is awesome, by the way. So congratulations on making it 8 months breastfeeding. You have been superwoman. So what I was saying about milk supply is that it is all a process of hormones. So then the more the milk is drained, the more milk is produced. So it all goes by with prolactin, for example, is the milk producing hormone. And then as prolactin produces the milk, what's going to end up happening is it's going to be released by oxytocin, which is that milk letdown hormone. So as the baby starts compressing the breast and the baby starts sucking with a good, deep, and wide latch, that's how you're going to be able to get some better milk supply. Now for number 3, it hurts every time we nurse. Will it get better? And the answer is it should get better with some latches and positioning. So breastfeeding should not hurt. Breastfeeding should be maybe a little bit of tugging, but if you feel pinching, that means that the baby's probably on a little bit too shallow, and you want to make sure to have a deep and wide latch. It's kind of like, I don't know if you know the old Sunday school song, Deep and Wide, but anyways, it's all about deep and wide latching, and then that will help painful latches especially. So if you find that every time you're nursing, you're in pain, it could be the latch not being deep enough. So what you want to do is, if this is your nipple and this is your areola, as baby's latching on, they're going to be more around the areola than the nipple. As baby's latching on, if they're on the nipple, that's how you're going to get the pinching, that's how you're going to get the stinging, and that's how it's going to be hurting a little bit. So what you want to do is have it more around the areola, where you'll be able to compress a little bit more. You'll be able to also get more milk out that way, and it won't be hurting. And then the way that you have the baby deep and wide is by positioning in such a way that it's going to have an open alignment. So let's say if you have baby on you, always belly to belly. Try not to have the baby, let's say, Some people try to hold the baby as a cradle with the belly, you know, all the way up in the air, and then they end up turning their head, and then that's how you get that pinching. So what you can do instead is bring the baby's belly towards you, whether you are like, let's say, I can show you here, let's say you're in cradle position or cross cradle position, whatever it might be, as long as when your baby is on, the baby is belly to belly. That's step number one. Step number two is you want to make sure that your baby's head, shoulders, and hips are in a straight line, that they're in alignment. If they're not in alignment, it's also very difficult to get an open latch because they're not going to open very wide. So what you want to do is if your baby's on you, you're going to have your head, shoulders, and hips in a straight line so that they're all in alignment. So we have the baby step one, belly to belly. Step two, in alignment, head, shoulders, and hips. And you also want to make sure that another big issue that I see a lot of moms do when they're nursing is that they tend to hold the head instead of the neck and the body, when you should be holding the neck and the body, but instead they're holding the head like this. Keeping the baby from being distracted while nursing. So my babies were very distracted all the time, especially once they get towards the 4 to 6 month mark and they start noticing what's going on in the world and they start being more sociable. So that's a great question. What you can do is, one, you can try to keep distractions to a minimum, although I know it's a little bit harder, but you can try to nurse in a similar spot. So for example, in the nursery, sometimes if I knew that it was an important feeding, so just how babies tend to eat more at different times of the day, what I would do is I would take a very important feeding that I know that baby tends to eat a little bit more, and I would make sure that I was free to be able to limit the distractions during that time. If I knew that it was a time of the day where my baby tends to be more of a snacker at that time, that's when I was like, all right, if I have to, be out and nurse at that time, then that's okay. But what I tried to do was limit the distractions when I could. Also, my babies didn't really like the nursing covers that much. So what I had to do was when I was out and about, what I had to do was I had to use the nursing cover for pumping actually. So what I would do is I would have the nursing cover as like, let's say we were out and about and I would be pumping inside the nursing cover, and then while I was out and about, I would give to the baby. I'm also just not very big, although breastfeeding in public is wonderful. It's just that was not necessarily for me. What I found was that it just worked a lot better if I was out and about pumping and then giving to the baby. Or if I was out and about and I could nurse, I would try to find a spot to nurse that wouldn't have that many distractions. Another thing that you can do as well is if your baby is on you, try to give the baby something that can distract them kind of on you instead of away from you. So for example, some people would have something hanging here, like a toy that they can play with and fill their hands, because especially babies that are 8 months old, they want to kind of play around, they want something with their hands. So sometimes even having like a little toy, or sometimes people have like a little necklace or something that's dangling here, sometimes that can help to take their I guess you can say their focus away from whatever's going on and instead focus it on what's really important, such as latching, of course. But that was such a great question though. And then, my baby is starting to eat food and less of milk. Should I pump when baby is eating food? So what you can do, it really depends on what you want to do for your milk supply. So some people, they still want to have a little bit more milk. Let's say if they're working and they notice that if you have a deficit of your milk while you're working. So let's say you go to work and you pump 3 times while you're at work, and you drink, let's say, and the baby drinks, let's say, how much does your baby drink while you are at work? Maybe we can start from there. Because it really depends if you need a little bit of extra milk. So about 4 to 5. So what you would want to do is if your baby is eating food and skipping feedings, what you would want to do is, let's say your pumping sessions are producing less than what the baby is eating. So let's say the baby is drinking 4 to 5 ounces and you're only producing 2 or 3. What you can do is fill up that deficit by instead pumping during those times that the baby is starting to breastfeed less and eating more food. So you can always do that as well. It's more of a how much milk supply do you need, although it is not necessary, because that is kind of the normal process of weaning as well. Although in the beginning, around 6-7 months, babies tend to nurse the same amounts as you introduce these complementary foods, and then as they get a little bit bigger, and then they start eating more complementary foods, that's when you'll start noticing that the baby will start nursing less. And then what you want to do is really up to what you want to do for your milk supply. But those were all great questions. Another question that I had as well deals with weaning. So sorry, I have some Coke here. So another question that I had was, what is the best way to wean or stop breastfeeding without getting engorged? What to do when period starts? Any tips to prepare with low milk supply during that time? Oh, so that's actually great, and that actually goes along with the weaning question. So what you notice, so there's is actually a birth control method called the lactational amenorrhea method, which is where you are less likely to get pregnant while you are exclusively breastfeeding. Now, that does not mean that you can't get pregnant. It just means that while you are exclusively breastfeeding, you are less likely to get pregnant as long as you don't have more than 8 hours overnight and you're feeding every 2 to 3 hours. When your period starts, or when you're no longer exclusively breastfeeding every 2 to 3 hours around the clock, and you're starting to get these long night stretches, that's when you're no longer covered by that method for birth control anyways. And then as your period starts, you might notice a little bit of a drop of your milk supply. Now, that's normal. Sometimes you might notice your baby will start latching on a little bit more during that time, just because they need to make up for that. What I did was I actually incorporated my period coming back with my weaning, which is actually one of my biggest tips for weaning, because I'm like, all right, if I know that when my period comes, my milk supply is lower, and I want to wean my baby off of the breast, what I did was I incorporated them together in kind of this really genius Rachel method. So what I did was, so when you're starting to do the weaning process, you always do every other feeding, dropping 1 feeding per week if you want to be very gentle, or if you seem like you have a lot of milk supply. And then if you don't have that much milk supply, or you're not really prone to getting that engorged, it can even be as soon as every 3 to 4 days, you would drop 1. What I would do is, when I had to start doing consecutive feeding sessions to drop those, I waited until I had my period. That way, if it was a consecutive feeding that I had to drop, so let's say baby eats at 6, 9, 12, 3, 6, 9, 12, and I dropped, let's say the 3 o'clock, I dropped the 9 o'clock, and then, so on and so forth every other. But now it's time to drop, let's say 3 and drop 6 o'clock. I waited until I got my milk supply. I waited until I got my period. And then what I did was, during that time of my period is times where I would try to have extra stimulation as well. So I would make sure that the baby's having effective feedings, keeping the distractions lower as well. And then, is it normal to get your period 1 month and not the next, and then get it again and it be very light? And yes, that is very normal actually, because usually when you get your period, it takes a little bit of time for it to regulate. For me, I would say it even took about 6 months for my period to regulate itself. So that is completely normal, and that is also why it's kind of difficult for family planning or birth planning as well, just because your period is so irregular. you might ovulate 1 month, you might not the other month, and it does take a few months to kind of set itself out, for regularity. You can even still have that irregular period for, like I said, it took me about 6 months, but you can regulate itself even while you are nursing as well. So for me, I nursed for 1 year, and then I would say I got my period back with my first. I got my period back sooner because I was breast and formula feeding with him, and I got it back around 6 months. But then by around, I would say the 9-10 month mark, my period was starting to be regular already. With my second son, he was exclusively breastfed. And what I noticed with him was I didn't get my period back until I was about 9 months into my breastfeeding experience. And then it took actually longer for my period to regulate. So I weaned them both off when I was 1 year postpartum. And then it took, with my second, 6 months, about 6 months for my period to regulate. With my first, it was a lot quicker. Also because I think I was, breastfeeding. Just because I think I was breast and formula feeding. So there were differences in that. But those were all great. And I hope I gave you some good weaning questions as well. So far, and anyone can feel free to chime in and ask questions. That's what I'm here for. This is meant to be a place where you can ask questions and feel safe to ask questions and learn more about breastfeeding, learn more about newborn care. And remember that I am a postpartum nurse. So if you do have questions about yourself or your care or a pregnancy, you can always let me know as well. And if you are watching this video after this class as well, you can feel free to drop in the comments any questions that you might have as well. So we went over so far babies that are in the NICU, milk supply. We went over age and milk supply. We went over painful latching. We went over distractions as baby's nursing. We went over periods when it comes back, low milk supply, and then how it's irregular. We also went over stopping breastfeeding without being engorged, although I do have more tips on that. Another thing you can do too is, if you are weaning, another thing you can do is Motrin, if you don't have any allergies, is good anti-inflammatory. So you can use that. You can use cabbage leaves as well. Cabbage leaves are really good for inflammation. Sunflower lecithin is very good for inflammation and reducing blood clots. You also can have nice massages. They even have this Silva lactation massager, which goes into my next question that I wanted to go over, which is clogged milk ducts. So can you take lactation cookies while pregnant? So Maria, that is an amazing question. Thank you for commenting on that. So while you are pregnant, you are producing colostrum still. And I actually have this hormone video. I love the science behind all this. So while you are pregnant, you start producing colostrum even 14 to 16 weeks into your pregnancy. However, it is not being released as much because your placenta releases these hormones called progesterone. And progesterone, what it does is it binds to the alveoli and the receptor sites of the prolactin, therefore inhibiting your milk to be released and inhibiting your milk to be produced. So although physically you can take lactation cookies while you are pregnant, however, it won't really do much because your placenta is releasing these hormones called progesterone, which will be inhibiting the prolactin. And that's pretty much what the lactation cookies are doing. So you can, however, it will not really have that much of an effect. The best thing that you can do to initiate your milk supply and start your milk supply is frequent and effective feeding sessions from as soon as the baby is born. So let's say your baby is born. What you want to do is within 1 hour of life, try to do skin to skin and initiate that first breastfeeding session. So another thing is some people, they kind of limit their breastfeeding session to, let's say that first hour, they limit their skin to skin for that first hour. But me, I've been a nurse for quite some time. And what you'll notice is that your transitional period is not just that first hour of life. It's a few hours. So why are we limiting our skin to skin to only the first hour of life? You want to try to have it during that whole transition period. So Maria, for your question, what you want to do, rather than take the lactation cookies while you're pregnant, you want to do skin to skin. You want to have frequent and effective breastfeeding sessions, especially in that first hour of life, but continuing especially during that whole transitional process. You don't want to introduce formula too soon either, just because you want to stimulate the breast as much as possible to bring out that mature milk supply. Because what happens is while your placenta is in the body, it's releasing that inhibiting hormones, that prolactin. As the placenta leaves the body, now your prolactin is no longer inhibited, and it starts the cascade that starts your milk supply. So as you are nursing your baby more frequently, you're releasing more prolactin, you're draining the breast, the prolactin is released, and you're going to be able to initiate your milk supply. So I hope, Maria, that answered your question. Now, my other question, any birth control safe to take while breastfeeding and preventing milk supply from decreasing? So yes, Jacqueline, there are. The most important thing is, more than which ones are safe, is which ones are not safe. So the ones that are not safe are the estrogen birth control pills, because estrogen is actually linked to inhibiting milk supply. So for example, how we were talking with Maria about how we were talking to Maria about how when the placenta is in the body, it's releasing the progesterone, which inhibits the milk supply. Now, Jacqueline, what ends up happening is, as you are taking estrogen birth control pills, the estrogen is inhibiting your production of your milk, similarly to the progesterone is during pregnancy. So what you want to do is, if you are having birth control pills, you want to make sure that you are having only the progesterone only pills, which are fine after pregnancy. I know there's so many things that are not good during pregnancy but are fine after pregnancy, like Motrin, for example. I always thought that was so confusing, how you can't take Motrin during pregnancy, but as soon as the baby comes out, ta-da, you can take Motrin. So the birth control that you want to do are stuff that does not have estrogen in it. There's also very little research about the shot. So for example, if you are going to have the Depo-Provera shot, there's little research on it, because there's some research says that it inhibits milk supply, and then there's other research that says that it doesn't. Which one is that, Jacqueline? I'm not familiar with that one. The one usually that we recommend is like an IUD or the mini pill. But I have not heard of that one. So maybe if you tell me, is that like a pill? Is it an IUD? Is it a shot or a hormone related? Usually what you want to do are birth control method pills. Okay. The best pills that you can do are mini pills. So they're as little hormones as possible with no estrogen. But that is very good. I have to look into that. So let me see. You said Slint. Let me see what's in it. Slint. Yes, that's fine, because it's a progestin only pill. Yes. So I was looking into the ingredients of your pill, and it looks like it's okay because it's an estrogen-free oral contraceptive. It looks like it has a 24-hour missed pill window, so you want to make sure that you are taking it around the same time every day. That will also help to decrease the amount of hormone changes that are going on. So yeah, so it looks okay. Looking at the ingredients, it looks like it's okay. So it seems like your OB made a good decision. But you can also talk to your OB for more specific questions. But in the terms of lactation, it doesn't look like there's anything in the ingredients that would inhibit lactation, based on the most current research, of course. But that was all good questions. You're very welcome. That's what I'm here for. So we were talking about weaning, birth control. We were talking about a little bit about milk supply and lactation cookies. Going into milk supply as well, I get the question is if there's anything that I should stay away from during lactation, or is there anything that I should have more of? So everyone always asks me that question as well. So in terms of things that you want to stay away from, really anything in moderation should be all right, at least most things in moderation. So for example, if you are having caffeine in moderation, it's okay. But if you are having, 5 glasses of coffee in one day, that might be probably counterproductive. So to what you want to do, especially because caffeine does travel a little bit to the baby. So what you would want to do is limit. So usually we'll say maybe 1 cup of coffee, or if you wanted to have like a soda or something like that, but try to limit in moderation. Alcohol, very similar. People ask me about alcohol sometimes. What you would want to do is in moderation as well after you're finished with your breastfeeding session, because alcohol does transfer to babies during breastfeeding. But what you want to do is wait about 2 to 3 hours before your next breastfeeding session. So what I'll normally recommend is, let's say you're at a wedding or something, you can always breastfeed first, then you can drink, so that you have a full 2 to 3 hour window before your next feeding session. Now, for things that are contraindicated, of course, are like illegal drugs. For example, marijuana use. Marijuana use has been linked to cross the blood-brain barrier and is very easily transferred to the baby as well. Same thing with, of course, other illicit drugs, the cocaine and all that stuff. But you guys are not doing all of that craziness anyways. But those are the stuff you would want to stay away from. So we went over the stuff that you can have in moderation, mostly caffeine, things like that. Then the stuff that you want to completely stay away from, of course, drugs. Also, another really interesting thing about alcohol. So I had the question, does alcohol increase your milk supply? Because somebody had said that alcohol calms you down, therefore does it increase your milk supply? Now, it actually does the opposite of increasing your milk supply, because although it might calm you down, and people said that it noticed a difference in there, is that alcohol will end up decreasing your milk supply because it inhibits your oxytocin, which releases the milk. So that is why it actually decreases your milk supply. So Maria said, Plan B, will that decrease your milk supply? So the thing with Plan B is that Plan B is very strong on your body. So if you can go against like something else besides Plan B, it'll probably be a better option. That's kind of funny. Do something besides Plan B, it will be a better option. Just because Plan B is very not necessarily harmful for your body, but it kind of resets your body hormonally. So if not for the stress level of kind of resetting your body so much, just the hormones by itself can end up having that change in your milk supply that you don't necessarily want. So in terms of birth control during pregnancy, usually the first 6 weeks, they don't really talk so much about birth control, mostly because you are time to go to Plan C. Yeah, exactly. But anyways, they don't talk so much about birth control those first 6 weeks, mostly because you're not really supposed to have anything in the vaginal area for 6 weeks. After that, they're going to talk to you about birth control, and the thing that you'll find most common are like IUDs, or like Jacqueline has the mini pill or the estrogen-free pills. Now, after that, another thing some people choose, which I mentioned before, is the lactational amenorrhea method, which is when you are exclusively breastfeeding with absolutely no supplementation whatsoever, at least every 2 to 3 hours, with even overnight not having large blocks of time without nursing your baby. With that amenorrhea method, until your period comes back, you are considered very decreased probability of pregnancy. Now, does that mean that you can become pregnant? Of course, these babies have a tendency to just like pop out. But with during that time, you're usually not that common to be pregnant, especially in those first 6 months or so while you are pregnant. Now, we were talking about Plan B. I mentioned that it kind of is a big shock to the body. So sometimes it's probably not the best idea to go to Plan B. And then Jacqueline said, let's try Plan C. So I hope that helped to give you a little bit of an idea. Another thing that you want to do as well is combination methods, especially if you are using barrier methods, such as, for example, condoms. So sometimes you can have like spermicidal jellies and condoms. Sometimes people prefer those because it does not have hormones, and it doesn't have all of these things that's going into your bloodstream and making a difference. So these are good questions. So keep them coming, keep them coming. I have questions here, but I'm like, hey, I can have you guys pretty much lead this session and where we're going, because you guys are the ones that are pretty much in this because you want to know more. So if you guys have any more questions based on what you are going through personally, that's what this is here for. Feel free to put it in the chats, and I'll be more than happy to go over it. So we've been going over some great stuff. So another question, we were going over weaning, contraceptives. Another question that I had was, do I need to give my baby formula to sleep at night? And that goes a little bit with gas and colic, and my baby seems like he's always a colicky kind of situation. So studies actually showed that moms who breastfeed actually get more sleep than moms that do not breastfeed. So I always thought that was kind of funny. I'm like, really? Because when my baby can't sleep, they always go, oh, give the baby a bottle and they'll sleep better. But in reality, it's, for one, when you are breastfeeding, you're actually releasing these hormones that help you to sleep more. So I remember, for example, when I was breastfeeding or I was pumping, just the act of milk expression makes you more sleepy. So I remember like pumping at work, and then I'm just like, oh, kind of falling asleep. So just because just the act of expressing milk makes you more sleepy. The act of breastfeeding makes you very sleepy as well. Another reason why you don't want to be like in a bed breastfeeding, for example, just because you don't want to fall asleep with the baby. Now, what you can do is overnight, you want to have good sleep routines during the day so that you can have better sleep at night. So usually babies tackle the nighttime sleep before they tackle the daytime sleep. So they'll probably have those good stretches of sleep at night, and then you can start tackling those nap times. Should you wake your baby if they fall asleep while nursing? So Brittany, that was such a great question. So it really depends on how long they've been nursing, how effective that feeding session was, and how long has it been since the last nursing session. So for example, let's say your baby fed an hour ago and then they wanted to have another little snack. That's when you would, let's say, put the baby to the breast and they fall asleep, and you'll be like, all right, they're pretty much done. Now, if you don't feel like it was an effective session, so let's say, because babies on average feed for about 20 to 40 minutes, although sometimes less, sometimes more. So what you want to do is, if you feel that the baby was not completely done with that feeding, that's when you would try to wake the baby up. You can try to burp the baby, give them a little rest, especially, Brittany, I think your baby is a little younger as well, so keep that in mind, that babies technically don't finish their full feeding in one sitting. What they'll end up doing is they'll feed for a little bit, and then they will have a little rest, they'll have a little pause, and then they'll start feeding more after they get their energy back up. So what you have to do with your feeding session, is you'll have to feed probably a little bit, give them a little bit of rest, give them a little break. You can even do a little massage, maybe even change their diaper, and then you can put them on the other breast, and hopefully they're more awake at that point. You can also try to hand express, help them, especially if it's a younger baby. If it's an older baby and they fall asleep, they could just be snacking. Just like sometimes you want a steak and sometimes you want a salad, it can just be snacking. So you kind of go from there and see your baby, and you more than anybody else knows your baby, so you'll be able to tell if your baby still needs a little bit more or not. And then what do you recommend for a stay-home mom that only nurses but would like to have a stash for when being away from baby? So one of the best little gadgets that I always recommend is the Haka. If you've ever seen a Haka, it's so helpful. I don't know if anyone has used the Haka before, but what's great about that is that you can put the baby on one side, as you are expressing milk from the other side or collecting milk from the other side. And the way that you use a haka, you're going to be, it has like this little neck area and then a little chamber. What you do is for the neck area, you kind of invert it, you close the chamber, apply it to the breast, and then close the neck area around the breast. And then it will help to express milk as you're nursing the baby on the other side. That's one way to get a little bit of a stash. Now the haka, if you are doing, let's say, cradle or cross cradle position, it's a little difficult to put the haka on the other side, the big haka, just because there's not enough space. So what you can do instead is like the ladybug one, where it's kind of smaller. It has a smaller chamber, but it has some really good suction that you can use that way. So I hope that can help make a little bit of a stash as well. Another one that you can do is, Jacqueline, you were mentioning before that your baby is breastfeeding a little bit less as they're eating more complementary foods. So if that is the case, what you can also do is, if you did want to have a little bit of a stash, you can always use those complementary food times while the baby's skip to feeding to instead express milk and save it for a later time. Another thing you can do is know your storage times, because sometimes people throw away perfectly good milk just because they're afraid that it went bad. Breast milk is different storage times than formula. For example, formula, once you mix it, it's only good for 2 hours or 1 hour at room temperature. Really, it's between 1 to 2. Usually after you mix formula, it's good for 2 hours. Once the feeding has started, it's good for 1 hour. With breast milk, however, it is good for 4 hours. I like the 4-4-4 rule. 4 hours at room temperature, 4 days in the fridge, 4 to even up to 6 months or even longer in the freezer. So what you'll notice is that the storage times are longer than people think. So sometimes they end up using up milk that's not necessarily bad yet. So what you can do is do a sniff test. So take a little bit of milk, put it outside like on a counter, and then let it go bad, honestly. So let's say take like 20 cc's, 30 cc's, like an ounce, put it on the counter overnight and let it go bad and smell it. So you can be familiar with how the milk smells so that you can end up doing the sniff test. So every time you give milk to your baby, and you can teach that to your caregivers as well, every time you give milk to your baby, do the sniff test. If it's bad, that's when you can toss it. If it's good, so that's one way where you can help conserve the milk that you do have. So to conserve milk or having the stash, we talked about instead of skipping feedings that your baby is skipping now that they're older, you can try to express during that time. We talked about being familiar with the storage times. Another thing you can do as well is educate your caregivers on feeding cues versus sleeping cues, especially because caregivers have a tendency every time the baby cries, they have a tendency to force a bottle. Like, baby's crying, take a bottle, baby's crying, take the bottle. So then what ends up happening is you use your entire stash just because the caregiver ends up giving milk when it's not necessarily due. So what you can do, Jacqueline, if you have milk that's almost 6 months, actually, if it's in the freezer or even deep freezer, it has the possibility of still being okay. So I would do a sniff test, but use it after defrosting within 24 hours. Do a sniff test. If it has a little bit of a soapy flavor, that is normal. Sometimes if you put milk in the freezer for long periods of time, if it comes out, sometimes milk has a soapy flavor. It's not that there's soap inside, it's just it has a soapy smell. So that's fine, but as long as it doesn't smell like when you do the sniff test that it smells like bad milk, then that should be okay. If you feel like you're not sure if it is bad or not, what you can also do is use it for other things. So you can put it in diaper rash creams. You can try to put it in, for example, you can put it in diaper rash creams. You can try to put it in milk as well. You can put it, you can put it in the bath as well. So like, let's say you have, your baby is having a bath, has eczema, you can put some milk in there. Even if it's not good to ingest, it might still be good for your bath, for example. So you can have extra milk, put it in baths, extra milk, put it in diaper rash creams. Some people even use it for acne or scars, because there's so many amazing benefits to the breast milk that you can use. If you're not, my biggest thing is if you're not using it for If you're not using it for actually drinking, there's other things you can do. Another tip, Jacqueline, also because your baby's older, you mentioned that your baby's 8 months. You also can take regular recipes, and whenever a recipe calls for milk, you can put your own breast milk in it as well. So if you have like a recipe for bananas with chia seeds, you can, instead of putting regular milk inside, you can put your breast milk inside. So that's one way to introduce the baby to new foods with still having that similar flavor of your breast milk. And then how do you use breast milk for eczema? And yes, people use it for the skin. People use it for, especially if you have eczema, you have acne scars, people use breast milk. What you can do if your baby has eczema is you can add it to the bath water. So the same way, let's say if you've ever used, let's say your baby had like a diaper rash or something, and you had they have those little like powder things that you can put inside. I forgot the name off of the top of my head, but like when my baby would have diaper rashes, they would have those little packets that you can pour into the water to help kind of alleviate the skin that had like oatmeal and all that other stuff. So you can actually pour your breast milk in just as if it was soap. And then what you can do also is even put it around big blotchy patches. You can put it around acne scars. You can put it around cuts, because what happens is breast milk has something called epidermal growth factor, and epidermal growth factor causes skin growth. So by simply having breast milk inside of the water, for example, as you are giving a bath, or having breast milk inside your diaper rash cream, that in and of itself is going to be able to help stimulate that skin growth. It's the same principle when you're having painful latches or sore nipples, that they say express your milk and put it around the nipple and the areola, because what ends up happening is it's going to help creating this film around the nipple and the areola, which will allow the baby to nurse without so much pain, and it's going to be able to stimulate that skin growth around the nipple and areola. So all very, very good questions. So we went over eczema, using milk. Oh, and another big tip too, when you're going back to work and you want to save milk while you're away, two big things. One, make sure you have the balance, like we were mentioning before, of how much milk is given versus how much milk is expressed. So you would want to have a balance. So if you are expressing, let's say, 10 ounces while you're away from baby, and baby's drinking 9 ounces, you're like, okay, I'm good because I have a surplus. But if baby's drinking 10 ounces and you're only expressing 6 ounces, you have a little bit of a deficit. So that's where you'll want to either express more frequently while you're gone, or teach your caregivers if you feel like it's kind of a overfeeding situation, something like that. So all good questions. If anybody has any more questions, feel free to ask them. But another question that I had was actually a really interesting situation. I'm not sure if she is on or not, but someone wrote to me. It was an email, and she said, I've been diagnosed with vasospasm. What does that mean, and how can I make it better? So she sent me an email, and I emailed her back. So for those of you who don't know, vasospasm is actually a very interesting breastfeeding situation where moms have these really constricted blood vessels that prevent blood flow after nursing. So what you'll see with a vasospasm is that it will be very, very painful, but only after nursing. So that's one of the biggest signs of vasospasm, is that while baby's nursing is okay, then after baby finishes nursing, as the blood is rushing back into the nipple, all of a sudden, mom is gonna be in excruciating pain. And when I say excruciating, it is like pins and needles in your nipples. So usually it presents itself in the nipples if people have had it previously but never really noticed it. For example, if they notice that in cold weather situations, usually those women end up very actually in pain when they are in those cold weather situations. So if you have vasospasm, the best thing you can do is make sure the baby's deep and wide on the breast. And then you also want to make sure that you are putting heat almost immediately after taking the baby off. So, because the pain is pretty much caused when the blood rushes back into the nipple, and then of course from the stopped blood vessels, because it's kind of constricted there, vasospasm. So what ends up happening is right immediately after breastfeeding, try to put something nice and warm on the breast and make sure the baby is nice and deep and wide. So I hope that answered your questions about vasospasm. And then another question I had was about the difference between mastitis and engorgement. So especially for moms who tend to have an oversupply, they might deal with engorgement and are wondering, when do I call the doctor for the engorgement, to know if it is more of mastitis or just normal engorgement. Now, the key with that are your symptoms. Engorgements, usually you'll just have, you might have a little bit of pain in the breast, fullness of the breast. They might be a little hard. However, it's not going to present itself with a fever. You're not really going to have that many clogged milk ducts, or they won't really be so hot to the touch and red. What you'll notice with mastitis is caused by usually clogged milk ducts that end up growing bacteria. Usually that bacteria is called Staphylococcus aureus, and then that bacteria ends up causing an infection of the breast, which needs to be treated with antibiotics. So usually mastitis presents itself with a fever, just as if you were pretty much like with a flu, but with intense breast pain. So you'll end up having a fever. You might have a lot of intense breast pain that comes suddenly. So that's the key with mastitis, is that it comes suddenly. All of a sudden you have a fever, all of a sudden you have a clogged milk duct, all of a sudden you have some really intense pain and soreness of the breast. You might have even redness. You're going to be lethargic as well. So the key with mastitis is, one, catching it early, so then hopefully you can be treated with by-mouth antibiotics instead of IV antibiotics. And then also managing the pain by Motrin for inflammation, Tylenol for fever. You can try to use warm washcloths. You can use massagers as well. Lactation massagers help as well in alleviating the pain. You can also try to prevent it if you see that engorgement is coming by making sure that you're massaging the breast, making sure that if you do feel a clogged milk duct coming, you're feeding that site frequently and effectively. You can even try to put the chin in places if it's around the breast or even in the bottom. Sometimes you might even be able to put the chin in that area to naturally be able to massage that out. If it's in this area, usually what I like to do is cross cradle, and then I'll use my finger and get any clogged milk ducts out from here. If they're in the inseam area in the middle, what I'll try to do is football position. That way I can use my finger here and try to get it out that way. So one thing you can do to prevent mastitis is simply by massaging as much as possible. Use heat packs cold after. If it gets very, very bad, you also can use cabbage leaves, because those help with inflammation. Cabbage leaves also helps when you're weaning and different things like that. But we definitely went over some great things. I hope you guys enjoyed this Q&A. I will be doing this frequently. In addition to childbirth classes, I'm also going to be doing breastfeeding and childbirth classes. So I really look forward to doing this in a more frequent basis. If you do have any more questions, you can let me know now. If not, you can mention maybe something that you thought was interesting, something you learned now. You can also look at more videos on my channel. You can subscribe, and you can always text me, call me, 954-471-6934. Here, I'll even you have questions. So I put my number there. If you have any more questions, I really hope that this Q&A helps you. You can always sign up for more as well. The calendar is in the description section. You'll be able to see it through Eventbrite, the calendar of all the classes that I will be doing. And then I do have the the in-person video as well. Well, in-person support groups as well. So I look forward to that. And you can always contact me if you have questions, message me, or even leave comments if you have any further questions. I hope you guys enjoyed this, and let me know if there's anything else that I can do. All right, see you later, everybody.